Exactly. Yeah, the primary won't be monitoring, but they'll use the clinician that's a specialist to consult with. And a lot of stuff now is in telemedicine. They do it, on the web. And I went to a nurse practitioner national conference in, I think it was in Vegas. There were 600 nurses at lunch, believe it or not. And I asked them before I started talking, how many of you see people with MS? Now remember, these were primary care NPs. Most of them raised their hand. So they do manage the patient, the things like symptoms, bowel, bladder, spasticity, they can do that, but they're not, they're not taking on the DMTs. It's just like somebody getting cancer. I don't think a primary care clinician would manage chemotherapy. It's amazing. I have still patients that I'm in touch with that were on the injectables years ago, and I don't want to mention which it was because they're all doing very well. There's some people that absolutely refuse to stop injecting. I have one friend of mine in New York, she's a good friend in New York, she will never stop her drug, ever. She doesn't want to take a chance. If she stops it and gets worse, she'll never recover it, And then you see many people going from one to another, as we call them doctor shoppers. They go from one to another. And there are many people out there that are trying things like stem cell therapy. There are places where they can pay for it. And there are some people that just settle in and are becoming very knowledgeable. They learn about their MS, they take their medications appropriately, they get their blood work, they get their MRIs. And so we have a very, very educated population out there. And thanks to organizations such as this, where they can log on and learn, it's amazing. They come in very, very smart. Whereas years ago, I remember when I first started taking care of people with MS, the one thing they would say is, when am I going to end up in a wheelchair? And it took me the first hour to teach them that wheelchair may not be such a bad thing, it's a tool. And if you want to hammer a nail into the wall, you need a hammer. And a wheelchair helps you get around. But those were real concerns. Today we're seeing fewer wheelchairs. We're seeing a lot more people stay in the workforce. And we see a very knowledgeable and very assertive population, which I'm thrilled about.